custodians of the country throughout of Australia and their connections to land, sea and community. We pay our respects to the elders past, present and emerging. And I'd also like to extend that respect to all Aboriginal Torres Strait Islander people joining us here today. I would like to thank Renata and Lachlan for planning today's webinar. Thank you so much for having us. And I would like to introduce just a few people from Services Australia that we have here today. So joining us from the Adapters to Web Services team, we have Christine Denham and Anne Strudwick. We also have Jeanette Mason from our PBS realm, and we have Leanne Shepherd from Aged Care. So I am hoping that what we go through today won't come as much of a surprise to any of you. However, we do want to make sure that everyone is on the same page, as we do have a critical deadline coming up on the 13th of March. So I am going to present my screen. Can everyone see that?
Yes, I can, thank you.
Perfect. Okay, so the Web Services project was motivated by a number of factors. Essentially, what we are trying to do is modernise our health and aged care payment and claiming systems to strengthen our security, stability, and also make it easier to update and improve now and in the future. I always like to talk about the Adapters to Web Services project in kind of two baskets, communication and authentication. So we'll start with communication. As it stands, all healthcare claiming channels, so this is Medicare Online, or as I'll refer to it throughout this, MCOL, ECLIPSE, PBS and Aged Care are currently built and communicate with us through a technology called Adapters. Now, this is our old legacy system. This technology sits within your software. So as we start moving away from that old legacy system to web services, all of those healthcare claiming channels I just mentioned will need to upgrade their software to a new web services compatible software. So if you haven't yet had contact with your software developer, it is really important that you do so as soon as possible to see what these changes mean for you moving forward. They should be able to give you information like when your product will be ready, what the deployment will look like, and how you will authenticate your claims moving forward. So that brings us to the second part, which is authentication. This is our PKI to PRODA. So up until now, in conjunction with that old adapter, all those old adapter products, accessing our system securely required a PKI certificate. Pardon me. These either would have come to you on a CD or was done as an automatic renewal. So that authentication process will be getting replaced by a PRODA organization. We do still want you to hold on to those PKI certificates though. They are still really important, which I will touch on a little bit later. But if you are a user of
Aaliyah, we lost your mic.
I'm so sorry. I don't know what happened there. Whereabouts did you hear up to, Chris?
You were just starting to say hold on to your PKI certificates.
Okay, perfect. So we really want you to hold on to your PKI certificates as they are still really important. I will touch on that just a little bit later. If you are a user of PBS and Aged Care, you will need to register for PRODA.org. You can do so now ahead of your software being ready. So we really want to be preemptive and try and get as much done as possible prior to you getting that software. So you can absolutely do that now, and I highly suggest that you do. If you are a user of MCOL or Medicare Online, it will be dependent on your software developer as to whether you will need a PRODA org. Some have decided to take on the responsibility of that authentication, some have not. However, we strongly encourage you to have that discussion with your software developer, as it is a business decision and only they will know. We won't be able to give you that information. There we go. Sorry for the delay, guys. Okay, so back to our PKI certificates. I take you over to the lovely bold sites must renew their PKI certificates now. It's very, very vital. And if there is only one thing that you take away from today is that message. To ensure business continuity, Services Australia will be renewing all SHA-1, PBS and Medicare PKI certificates. So these PKI certificates can be used for secondary purposes such as healthcare identifiers or HI service, the prescription exchange and secure messaging. It is really important that we do get those PKI certificates renewed, even if your current certificate is yet to expire, and even if your location has transitioned to PRODA to authenticate, you still need to get that new PKI certificate installed. For support, your first port of call will be your software developer for installation advice. However, if you do need additional assistance, you can contact eBusiness and our online technical support team will contact you at a later time to give you that support. Okay. So if you are a user of Medicare Online, ECLIPSE, Aged Care or Aged Care Online, and you have not heard from your developer, you should contact them now and confirm when your software will be available. And if you're an MCOL and ECLIPSE user, whether you will need to register your organization in PRODA. If you need to register in PRODA, you can do so now, and you do not need to wait until your software upgrade is ready. Aged Care can register online now for their PRODA org, and as can PBS Online. It's really important to note that for PBS, the software developers will be contacting their customers. So Jeanette has been doing a lot of work with that cohort, and they will be in contact with their end users with any information. Now, if you don't happen to have a software developer, either you bought a product off the shelf and you don't have a relationship with that software developer, or you have heard from your software developer and they're not going to be creating a web services ready software product, we actually have a fantastic list of web services ready software products available on our website. So just in the corner square over here, you can go to servicesaustralia.gov.au, search for software developer, and then follow the link on how to find a software developer. Now, we've had a few questions come in around the HW207 form. This form only needs to be completed if you are being issued a new minor ID. So if there are any other sort of information changes, such as your bank details, that can be done via HPOS or over the phone. And changes like your address can also be advised over the phone. We're hoping to have that change of address as an update to HPOS in the future as well. So please only complete this form if you are being issued with a new minor ID. Otherwise, it's not necessary. how are we supporting healthcare locations? Okay, so we have been doing a bunch of work to get this message out. And thank you again to Lachlan and Renata for having us today, because it is just another way that we can spread this message and support the industry in these changes. So this project started back in 2018. Back then we started engaging with software developers as they're kind of the first link in the chain. So we spent a lot of time supporting them so that they could have their products ready and deployed by the 13th of March 2022. In terms of communication with users, we started communication in 2020. Now, this was a hard copy letter to all healthcare locations registered with us. The message at that stage was just it's a very soft approach. It was just touching on what the changes were. And to be honest, 2022 seemed like an absolute lifetime away. So as you can imagine, the messaging urgency has since been ramped up. We've been engaging in every way possible, and we've got a bunch of examples in that wonderful wheel on the screen there. Very quickly, while we're on this page as well, I do want to touch on our web services e-kit. If you have not, please do have a look at it. I will post a link into the chat after the presentation. There's so much work gone into this e-kit. You'll find a number of resources which will help you transition to web services and PRODA, such as fact sheet, process flows, key updates, etc. Okay, so if you're hearing this and you're going, oh my goodness, I've never heard of this, and we are, 20 something days away from the deadline, 24 to be exact, don't stress. We are here to support you. So we have been working tirelessly with industry to mitigate risks associated with healthcare locations reverting to older and inefficient processes such as paper claiming, should your developer not transition you to web services by the 13th of March 2022. So as I said, we are there to support you and we want to work with you. So if you are hearing this and you have concerns about meeting that deadline, please send us an email to help.webservices@servicesaustralia.gov.au. Make sure you're having that conversation first, though, with your developer, if you have one. If you don't, again, you can go to our website to find one with a web services ready product. So for more information and support, again, your software developer should be your first point of call if you are an MCOL, ECLIPSE or aged care user. For MCOL and ECLIPSE, ask if your location will need to create a PRODA organization. PBS and aged care online users can start registering their organizations now in PRODA. And anyone using PBS will be contacted by their software developer should they need more information on anything. For web services and PRODA support materials, you can contact the e-business line on that 1-800 number, option 1. We have our PRODA page on our website to access any step-by-step guides. Again, we have our wonderful e-kit. Please do access that one. It is fantastic. And we also have PRODA simulations on our health professional education resource gateway. So they will help you apply for your PRODA accounts, and they are really fantastic. If you've never done it before, it's a really good way, step-by-step process. You can watch someone doing that. So please do have a look at those as well.
Leah, I've put the link to the e-kit in the chat.
Thank you so much, Chris. That is it from me. Now, I know I've just given you a whole heap of information, but do we have any questions? And please, if you do have any questions after this, because again, I've just given you a whole bunch of information, more than happy for you to email that help.webservices email box as well. And they will They, me, Shelley, and a few others will be able to assist you with those. Kathy. Hello.
Hi, Elia. So I'm Kathy Rainbird. I'm here from the Australian Digital Health Agency just to assist and provide support from
Hello.
our end as well. Nice to meet you, Elia.
Nice to meet you too, Kathy.
Thanks for the presentation. One of the things that we've been hearing from a lot of the PHNs is the confusion around the fact that there are 2 PKI certificates. So just wondered if you would care to clarify that, or if you'd like me to.
I would love for you to quickly jump in there for me, Kathy. Thank you. And I'm so sorry, I didn't realize you were on the call. I'm sorry, I would have introduced you as well.
No, that's fine. So basically there are the 2 distinct PKI certificates. So for everyone on the line, be aware that there's the Medicare PKI site certificate, which is the one that Aaliyah was alluding to, which is going through that transition to web services. Separate to that is your NASH PKI certificate, and that's what you use to connect to digital health services such as electronic prescribing and My Health Record, and in the background the health identifier service, which allows you to use those systems. So both of these certificates are the ones that are coming up potentially needing to be renewed. So along with Aaliyah's message to renew your Medicare PKI certificate is also the message to make sure you've renewed your NASH PKI certificate if it's due for renewal. So you can check the renewal date, or your organisation maintenance officer can check that renewal date by logging in through HPUS. And we've got step-by-step instructions. I'll post them in the chat pane. There's a link to our webpage specifically about the NASH certificate side of things, and with step-by-step instructions on how to renew that.
Kathy, does that answer Pauline's question in the chat? She says, we are a pharmacy and I've downloaded the NASH PKI certificate from PRODA. I'm not sure that it comes from PRODA, but yes, and installed it into our dispensary. Is this all I have to do? Now, I can't hear you, Kath.
Sorry, forgot to unmute again. So that's for the NASH PKI certificate. So as long as you've downloaded that and it's been installed, then you're good for that side of things, but you still need to do the Medicare PKI certificate side of things, and that's where Aaliyah comes in. Aaliyah, would you like to respond?
Yeah, thank you. So I just want to very quickly touch on that help.web services mailbox as well. So we recently in our software developer, pardon me, sorry, our software developer newsletter have introduced being able to tell you where your PKI status is sitting and how that will be renewed. So if you are interested in knowing if your PKI certificate is an auto renewal, which will be done in the background, or a CD update, which is a manual, please contact us with your PKIRA number to that help.web services mailbox, and we'll be able to do that in the background, come back to you with that information and let you know whether it's been renewed or if it needs renewing. I'm just going to have a quick look at some of these questions here and get a very quick drink. Pardon me for 1 second. Chris, is there any that you can see that you can touch on while I quickly run and get a drink?
Yep, that's fine.
Thank you.
Thank you. Had not planned to be on camera, but hello. Just reading through Darren's, just wondering if we can get some guidance on where to find updated Medicare PKI certificates. Our Medicare certificates in our practice management software expire on the 13th of March. The software developer will not have web services ready. Now, there is a lot of work being done in the background since about June last year, where we have been trying to auto-renew all of these certificates. So the possibility is your certificates may have already been auto-renewed. The difficulty comes that there were some that we weren't able to authenticate if they were still valid. So those ones did not auto-renew. Now, they're the ones that if you received a CD in the mail, it'll be in a white Australia Post CD mailbox, and a password would have come in a separate mail and looks a bit like gobbledygook when you open it up. It is not junk mail. They used to have a blue patterning on the back of the envelope, and it really looked like an old pay slip that you were getting in the mail. Anyway, that's your password for the CD. You do need to install those. No matter what you're doing, if you get a CD in the mail from us and it's a PKI site certificate, you need to install it. So if you haven't received a CD, but your expiry date, as you said, is the 13th of March, I would contact your software vendor just to see if or your IT person to see if the certificate has been auto-renewed in the background. They should be able to see that. I think the place it's normally stored is called a PSI store, but some software companies chose to keep it in different places, so you would need to probably check with them on that. As Aaliyah said, you can always email the help web box, and I'm trying to remember the full term of that because it's not my web box.
That's okay. I've put it into the chat for anyone that's looking for it.
Right.
So please do reach out if, for whatever reason, if your software developer can't help you with that. It's also worth noting that, as like with the with the PRODA authentication, some software developers may also hold that PKI certificate. So if your software developer holds that PKI certificate and you are knowing of that, you can contact them and just double check and ask if that is all up to date if you are concerned. But you shouldn't have to be. They'll be coming to us and asking the questions.
And Lachlan said that, Kathy, you may want to reply to Marie's question, do they need a PKI certificate?
So Marie, I might get you, I don't know if you can unmute yourself, but it depends really on what you are doing in terms of whether you need a NASH certificate. If you are using digital health services such as electronic prescribing or My Health Record, or connecting to the health identifier service or secure messaging, then you may well need to have a NASH PKI certificate. Some software, similar to what Aaliyah was describing, some software developers actually hold that security certificate for all of their clients. So in that case, you wouldn't need to have a NASH PKI certificate, and they hold that for you as what's called a contracted service provider. But the trick is to know whether you have one. If you have one existing, if you log on to HPOS, if you're the organisation maintenance officer for your organisation, log on to HPOS and go to the organisation certificates tab, follow the prompts that I've posted in that link to the website. It takes you step by step through, and you'll see there a list of your certificates. And if you have a NASH certificate, it will be listed in there with the expiry date. If the expiry date is after the 13th of March, that means you're in the clear, you're home and host for now. Don't have to worry about it any further. But if it is expiring on the 13th of March, make sure you hit the download and get it installed before that cutoff date of the 13th of March. Does that answer your question?
Yes, you did. We don't use any of that yet currently, My Health or so I was thinking we probably would wait until we get the web server with the the Medicare on before I look at that then.
That sounds fine.
Can I ask another question about the PKI certificate? In the mail in July last year, I received a new PKI with the password and everything, and the letter states that it expires in June 2024. Now, Alana, what you mentioned was that even if you've got one, you need to renew one if you've got it. Does that apply for this? Because I have tried to ring eBusiness a few times, and every time I someone gives me a different answer. So I'm very confused because I've heard, well, if the letter states that it expires in June 2024, you'll be fine. And then they said, well, maybe you won't. You probably should speak to your vendor. And the vendor's like, no, that's not on. That's to do with Medicare and the Services Australia. So I just probably would like a bit of clarification of this PKI I've got that says June 2024. Do I now need to renew again
No, the one you've got with June 2024 is the one we're aiming to get everyone to have. So
Right.
if your certificate expires after the 13th of March 2022, you've got the right certificate in there. If on your system there's one that expires on 13th of March 2022, you haven't got it. So
Right.
if you've got one that says any date beyond that, you're fine. It means that all your secondary services, everything will still keep running. But if in your case, it's great. It sounds like you've got the right certificate. So long as you installed it and activated it, it's fine. You've put the password in and you've sent transmission since then, you're all set to go. It's
Okay.
only those that still have the certificates that end on the 13th of March 2022.
Thanks, Christine. We haven't installed it, but I will go to our vendor.
Please do. Please, you're on my list somewhere then, because I've been doing the calls for some of that as well.
Thank you.
Please do. You will save me some calling.
Okay, so yeah, so that should be by our vendor that I give that to, or your PSI, PCI, PSI.
PSI store. It all depends. You may have an IT person that installs those for you. There's a number of different ways they get installed. Some people install them themselves because there is an installer program on the certificate. Other people, it's their software developer has to do it. It's all different across the industry. It's however it was determined by your software developer. So
Okay.
if you've got an IT person that normally does runs all your updates or whatever, then that would be the person I would talk to first. If you normally do it yourself, all those sorts of things, you can run the certificate to see if you've got the capability to follow it, because I know sometimes I used to install them in the past and some people got it and some people didn't. If you're in doubt, go to your IT person or go to your software developer.
Okay, thank you.
Okay. It's got a little wizard in it that helps you install them, but
Okay.
it's a few years since I've done it now, so I can't quite tell you the full process.
Sure, no worries. That's helped a lot. Thank you.
You're welcome.
Chris, you might be able to help with this one, because I'm actually not quite sure. Are the Medicare PKI certificates available in PRODA or HPOS, or only via CD or automatic update?
Okay, this is where the confusion between the NASH certificate and the Medicare certificate comes in.
Yeah.
Correct me if I'm wrong, Kathy. My understanding is the NASH ones are done through HPOS. So PRODA is your authentication to get into HPOS, and HPOS is the system, and that's where the NASH certificates are done. For the Medicare side of things, it will be either a CD that you'll get in the mail, or we will try and do an automatic update to get those renewed automatically for you, and you won't even know that that's been done. That's the aim, to get everyone done. We did try, however, the PKI system is an old system and it relies on another external organisation, Verizon, and so there were some that just couldn't be done that way, and they're the ones that got the CDs. So if you get a CD and you get the password, please install them.
And if you haven't received that CD as of yet, or it's, blame COVID, it's gone missing, someone's put it in a drawer, something like that, please do reach out to that help.webservices mailbox as well, because we do need to get you upgraded as soon as possible.
And the other thing is as well, because most of the ones that got a CD, it's because we haven't had direct contact with you or the certificate manager. That's the person that the certificate would have been mailed out to. And that may be that person could have left your organisation up to 6 years ago. And so that CD would have still been addressed to that person, because we haven't been informed by you that they're gone and that you need a new person added as your certificate manager. And this is why it's really important when we ask you to revoke things, if you get changes, like changes to ABNs, changes to people who are in authority, that sort of thing, or you buy out a company, we really need to know that information, because when these sorts of things happen, we've mailed that CD out to the person who was there 6 years ago. And of course, you've probably sent it back saying no longer at this address, which means that CD's gone into Australia Post black hole, or it could be somewhere in a vault. No one knows where. If if you need a CD, we're working in the background as well we're running reports to see who's received a CD and haven't installed it. Now, as I said, I've already made some phone calls to different people to say, look, we sent you out a CD on this date. Have you got it? Have you installed it? If you haven't, please install it now. You do need it. So rest assured, we are working in the background on those reports, and we are trying to contact everyone that we know hasn't installed that CD. So if you've got it, install it now, and that'll save us a bit of trouble. If you're not sure, you've got the help web box, that help.webservices web box that you can send it to and say, look, we just don't know. Or if you've thrown it out and you remember vaguely throwing something like that out, please contact us and we'll tell you what to do. Does that help? Oh, sorry, Aaliyah, I hope you're all right. Now, I'm just looking, I think it's Curtin Chapel Chemist. I'm just reading yours. My PRODA PBS certificate expires in June 22, so I don't need to renew again before March 13, right? And to check if it's auto-renewed, I just contact the software developer. Or does this in PRODA as an organisation? So your PBS certificate is very similar to the Medicare certificate. It's not renewed through HPOS. So in that instance, because your PBS, I would suggest your software developer might be your best course of action at first, because it's possible they may know something about it. And I think to go to PBS Web Services, you would have all had to start doing your PRODA organisation registration, because I believe with PBS that's the way you've got to do it. Your certificate expires in June, so you're not going to lose the secondary components of that, like on the 13th of March. But of course, if it does expire in June, you'll need to find out whether that will auto-renew in June, or whether that will need you to do a request to see if you get a CD or how that works. It won't hurt to email that certificate RA number to the Help Web Services box, and we can check it for you. I'll just make sure everybody knows what the certificate RA number is that we're talking about. It's the registration authority number. On the discs or where your certificate's stored, it comes with a registration authority number, which is shortened to RA number. And that number is the one we need to look up to make sure that certificate's okay.
So if an organisation hasn't received the CD, but they want to check whether it's been auto-renewed or not, you said they need to send that RA number. How else can they find that RA number?
You can find it on the Certificates Australia website on Verizon. There's a search on there for healthcare directories, and you just key in the name of your business and it'll bring up your certificate. We can do that, Aaliyah, can't we, if we have their minor ID and their business name?
Yes, so if you do not have your PKI RA number, as long as you have your minor ID and your location name or site name, we can look that up for you. Okay, we don't have a PKI certificate. Will we get a CD in the mail to upload it? So this will be dependent on a couple of things. So where we can, we have auto-renewed our PKI certificates. For those that we could not, we have sent a CD, which is a manual update. If you are unsure, please let us know what your PKI RA number is. If you do not have that information, then you can send us your minor ID and business name and we'll be able to look it up for you. I hope that covers your question, Carol. Do we have any other questions? Feel free to put your hand up, jump on camera. Don't be shy, we don't bite. Okay, guys. Oh,
sorry. Can I just ask one question? I'm not very good with this, so I forgot to put my hand up. Very rude of me. Sorry.
No, that's okay.
With the when you're saying like the form, the HW027, we had different like ABNs going through that, our original minor ID and the PKI certificate. So our vendor issued us new minor IDs for those. So they're the one we'll have to fill out just that form, because nothing in the bank accounts or anything's changing. It's just the minor ID for certain sites.
Yeah, now this is something that you may need to go back to the software developer for, because it does depend on the software developer. Some of them are arranging that on your behalf. We are in discussions at the moment trying to work out the best way to do this for bulk changes to minor IDs. There's a couple of options there. One of them involves the providers ringing our e-business service centre and updating via the phone. At least one provider under that minor ID would need to do the form. There are other ways to do it at a corporate level. So we're still discussing the best way to have those changes done. And if you talk to your software developer, they will be able to tell you if they're already in touch with us trying to work that out for you.
Oh, okay, because they gave us our minor ID and then just said you'll have to change your practitioners. So I might double check again, because
Can we ask what your minor ID starts with? The first three letters?
KES. So it's
KES. Yeah, okay. I was trying not to say that out loud, but that's okay.
I will.
Okay. It was Marie, I think, that asked that question.
Yes, that's correct.
Yes. Marie, if you just want to email the Help Web Services box, Leah does it so much better than I do, and just put your minor ID in there, we can have a look for that for you.
Oh, okay. So that means, and the new ones that were issued to me, or?
Yes, just put both the old and the new minor IDs in there and just ask the question in the email and we'll have a look for you.
Thank you.
That's okay.
Thanks for covering that one, Chris. I knew there was a lot going on in the background,
yeah,
and I knew
lot.
you'd be the
and
woman that would know.
There isn't a final decision made at this stage, so we're just still trying to get it the easiest way possible. We're fighting, Marie, so that you don't have to do anything. But
that would be perfect.
It would be. It would be, but it's not approved as yet.
Okay.
Just on that as well, you know, we are very close to the deadline. So things are moving quite quickly in a lot of different realms. We are trying really hard to make sure that we're doing everything we can to support you. As Chris said, you know, we are fighting in the background to make the process easier for you. And no truer words have been spoken, because we really are. We are doing absolutely everything we can. So please know, if we do give you information from 2-3 months ago, if you've been in contact with us, that could have potentially changed coming to now, particularly with aged care as well. So we're currently in talks with aged care in regards to business continuity for them. There will be an aged care webinar for software developers coming up to discuss their timeframes. So it is a forever moving space. Please know that we are doing everything we can, though, to make sure it's as easy for you and the software developers. You know, we want to get everyone across the line as quickly as possible. Do we have any other questions?
Just letting everyone know that a previous version similar to this webinar that was recorded, I've just put it in the chat, links to our PHN website. Down the bottom, there's a Vimeo video that you can just click play, and yeah, that should help you if you've had any audio problems. You can rewatch it that way.
I will just add there, Lachlan, because I use a Surface Pro that doesn't have a headset. I had a lovely view of it without volume and had to run and get my, what are they called, ear pod things for your telephone and plug that in. That was one way to do it. So just in case there's other people out there like me that didn't have the headsets available, you can use just those telephone plug-in ones.
Beautiful. Well, if we don't have any other questions, I might throw over to you, Lachlan. I just want to say thank you again to everyone, and please reach out to that help.webservices if you don't if you do have any questions. Sorry, I just saw Pauline. I don't know our minor ID. Can I just email through the business name? Sorry, go Chris.
I was going to say, Pauline, if you know your software developer as well, you can put that in as much information as you can in your name, your business name, your address. You could even put a provider number of a provider at your practice, because that will help us link to the minor ID as well. I do those searches as well. It's great when you've got not enough information. So as much as you can put in there, please do, and we'll find it for you. Carol, you're saying that it's saying page not found to the link that Lachlan put up. I think he's just put another one up. I'm hoping that one works. And the other thing, I guess, I believe a lot of you are practice managers talking to us today, or talk to practice managers. A lot of our staff in this team have either worked in business development or a similar environment. So we're very, very aware of the difficulties you face with this. As I said, I used to come out and install the old CDs with you, so I do know the frustrations out there. So rest assured, we are working with everything we can to try and make this as easy for you as possible. And that's why we developed the e-kit and a few other things that some of our different parts of our team have developed. But thank you for your time.
Thank you so much for that, Chris. And thank you, everyone. Lachlan, over to you.
Oh, yeah, I'd just like to say thank you again for Services Australia and Alia for presenting this, and also all the other representatives from other agencies who have contacted us and joined in to assist today. Yeah, so if you have any remaining questions, feel free to contact anyone at their respective addresses, be it the Digital Health Agency, Services Australia, or feel free to contact us at the PHN too if you'd like us to forward something on. All right, thank you very much, everyone. We'll close it there. I'll end the recording, and yeah, just feel free to use that link in the chat to access it again. Thank you.
Thank you so much.
Thank you.